That urge to move your legs at night, that's not random. That's actually restless leg syndrome, and it's stealing your sleep from you. Restless leg syndrome causes insomnia and disrupts your sleep, and you don't even realize that it's happening sometimes. You've gotten so used to your limbs moving before you get to bed that you think that's just part of your sleep cycle. It isn't. It's a neurological condition, and it actually can steal the really important sleep that you need to be restored for the next day. The American Academy of Sleep Medicine has released new guidelines on how we should be treating restless leg syndrome. First and foremost, restless leg syndrome is a clinical diagnosis. What does that mean? That means that we need to be asking you the right questions on whether or not your limb movements are preventing you from getting to sleep. Restless leg syndrome usually happens at rest. It is an uncomfortable feeling that builds in your limbs. Sometimes we call it creepy crawly, sometimes we call it pressure. However, it builds up to the point where you feel like you just need to move. Then all of that irritation is then released. You feel good, and then it builds right back up again, and it's preventing you from getting to sleep. Sometimes people have restless leg syndrome when they're watching a movie, when they're watching television, when they're in the car for a long car ride, or when they're flying. Restless leg syndrome always happens when you are awake. It is a conscious phenomenon. Periodic limb movement disorder is when you are unconscious, and that's a whole different discussion. Second, we need to treat the root cause, which typically is iron deficiency. Now, you're probably thinking, I've already been tested. My blood count's normal. My ferritin level was normal. My total iron binding capacity was normal. I don't have iron deficiency. But that's not necessarily true, because we're not talking about iron in the bloodstream. We're talking about the iron that needs to pass through the blood-brain barrier to then help with dopamine, the main neurotransmitter for movement. Oral iron can be used to treat restless leg syndrome. However, new in the guidelines is the use of IV iron. That recommendation is a big change from previous guidelines. Iron deficiency is one of the most undertreated symptoms of restless leg syndrome. Secondly, we need to treat iron levels in your body. We do that by testing a couple of things. One is ferritin, and the other is transferrin. Ferritin levels should be above 75 nanograms per milliliter. Now you're thinking, wow, that's pretty high. I was already told that my ferritin level is normal, my blood count is normal, and my transferrin is normal. However, if you have restless leg syndrome, you really need that ferritin level greater than 75. And if you continue to have symptoms, sometimes we shoot for 100. Why do I need a ferritin level greater than 75? Well, it's not just iron in the blood, it's actually iron in your brain. Iron needs to pass through the blood-brain barrier. Iron is required for dopamine synthesis, which is our neurotransmitter for movement. If we don't have enough iron passing the blood-brain barrier, then dopamine synthesis is hampered, and this causes restless leg syndrome. That instability with dopamine neurotransmission shows up as this urge to move your limbs at night or at rest. When iron is low, dopamine synthesis becomes a little bit unstable, and the signaling is hampered. And this shows up as restless leg syndrome, that urge to move your legs at rest, preventing you from getting to sleep. This is why we need to aim for higher iron stores. The third thing that's really important to remember around restless leg syndrome is that we can use other medications if your iron stores are at the right level. Those medications now have changed a little bit with the newest guidelines. We used to use dopamine agonists as the first line of treatment. Now it's actually the second line of treatment. If you need to use a prescription medication, the first line of treatment is now medications like Gabapentin or Pregabalin. Secondly, if those don't seem to work, then we do move to the medications like ropinirole or pramipexole. So why is there this shift in the guidelines? Well, what was found is that people were having augmentation. What is augmentation? Augmentation is when you have restless leg syndrome in the setting of using these medications like Requip or ropinirole or pramipexole, and you start having restless leg symptoms earlier and earlier. That's the definition of augmentation. In order to help treat restless leg syndrome, we have gone back to the root cause, which is really aggressively treating iron stores. If that doesn't work or isn't getting rid of all of the symptoms of restless leg syndrome, then we move to something like gabapentin or pregabalin. What are some contributing factors that can affect your restless leg syndrome? Antidepressants are a really common side effect of aggravating restless leg syndrome. SSRIs, SNRIs, lots of caffeine. These are common medications or substances that can affect restless leg syndrome. The other class of medications that can affect restless leg syndrome that people rarely think about are the original antihistamines like Benadryl or chlorpheniramine. These are common older antihistamines that are in many over-the-counter medications, but they can actually increase your symptoms of restless leg syndrome. Common medical conditions that can affect restless leg syndrome are pregnancy, neuropathy, and chronic kidney disease. Behavioral factors that can affect restless leg syndrome include sleep deprivation, irregular sleep timing, and sedentary behavior late in the day. That means exercise is probably a good thing for restless leg syndrome. The last thing is using other things that can help you relax yourself in the evening. These are non-pharmacological therapies that are what we call adjunctive, meaning that they help bring you to that relaxation state and may reduce the irritation of the restless leg syndrome. That's taking a hot bath, doing some moderate exercise, stretches. These all help with reducing the intensity of restless leg syndrome. The key here is treating with iron first and making sure your ferritin levels are above 75 and for some people close to 100. It typically takes 2 to 3 months to see the ferritin level change and the iron stores change. So you have to be patient with the iron replacement. If replacing iron isn't working, then combination therapy is recommended. What most people miss about restless leg syndrome is it's not just an annoyance. It's not just this thing that is affecting your sleep, but it's actually a neurological condition that can be and should be treated. The key points about restless leg syndrome are it can be treated. How you should treat it is with iron first, and then think about prescription medication. Lastly, behavioral changes can help reduce the intensity of restless leg syndrome.